So I've come across like reading. I've actually seen this flash pulmonary edema so many times. So I've been reading about hypertension, and I just said, let me do some research on it. So let's quickly look at this and what it is, what it means. Okay. So pulmonary edema, just like you just have to do it. There's accumulation of fluid in the lungs. You know, so it's a severe form of acute pulmonary edema. And anytime you hear flash, it means the thing is occurring all of a sudden. You know, so usually, you know, due to what abrupt cardiac dysfunction like hypertensive crisis, and acute ischemia or renal, artery stenosis. So what is it? It's a rapid onset of cardiogenic pulmonary edema. So accumulation of fluid in the lungs and it's occurring too fast. Okay, it's occurring too fast. All right. So mechanism, there's a sudden rise in the left-sided heart filling pressures. It will force fluid into the alveoli. So to trigger hypertensive, it triggers things like hypertensive emergency, acute myocardial infarction, then tachyarrhythmias, valvular disease, you know, then bilateral renal artery stenosis. Okay. So all these things we discussed them when we were talking about hypertensive causes of secondary, hypertension. So that's what we got. So symptoms is a sudden severe difficulties in breathing. So all of a sudden you are not able to breathe very well. You are feeling as if you are drowning or suffocating. There's a pink or blood tinged sputum. You have cold, clammy skin, sweating, and you are pale. So also chest pain, okay, dizziness and confusion, rapid breathing and wheezing. So why is this serious? It's life threatening because it occurs so quick, you understand, and oxygen levels in the body are actually dropping so fast, you know. So there's actually a risk of organ damage. Okay, there's a risk of organ damage. Okay, so diagnosis here is clinical presentation is sudden respiratory distress. So there's frothy sputum. As the person is making sputum is frothy. You know. So chest X-rays, you see bat wing infiltrates on the chest X-ray. Echocardiography can show you a left ventricular function and valvular disease. Also, different blood tests can be done, and also ultrasound can also be done for that. So treatments include primarily this patient is having issues with breathing. So make sure that they are receiving their oxygen. Okay. Then you give vasodilator drugs to help widen the blood vessels so the blood supply is maintained. Then diuretics like intravenous furosemide to remove the excess fluid, inotropes to support heart function so the heart will keep beating. Then treat any underlying issue or any underlying cause. Okay, so that's what we got for this.